Hello, everyone, and I'm delighted to be able to share some thoughts with you for this very important conference on digital phenotyping and personal sensing across health. The title of my talk is When Will It Get Real? I was so pleased to be invited in the earlier part of the last decade, say through 2013, 14. I began a series of blog posts and writing about and talking about this whole notion, and that led to a book that I published in 2015 called The Internet of Healthy Things, which really dove deep into the idea of how we can use sensor data and other digital phenotyping data as a way to personalize healthcare delivery. Of course, always emphasizing that we need to be motivational for folks so that they will actually change their behavior. And that was a launch of a very important thought leadership part of my career. So very, very honored to be part of this today. And these are some of the screens that I showed in that initial talk that I gave in 2015 about the Internet of Healthy Things. So this looks topical, but it's a few years old. And of course, we can track so many things these days. This is just the tip of the iceberg: steps, weight, blood pressure. But as you all know, you can track menstrual cycles. You can track so many things with sensors now, and there's so many different ways on the market. And the notion behind the digital phenotyping is that, like genotyping, you have a unique signature to your own personal data. And your own personal data is something that we can now capture, given the vast nature of cloud services. Use that data to create a unique persona of you and of one. And then, as I said earlier, part of that journey is understanding what motivates you and using the unique change in your persona from all this tracking as a way to trigger motivational messaging and coaching and so forth to get you on the right track. Now, I talked about that as a vision in 2015. I'm now advising at least 2 companies that are executing that vision. So it's a really exciting time. Now, why do we need to do that? It's simply, rather not simply because it's a cool thing to do, but this graph is really, really important and illustrates the challenge that we have. And that is that the demand for healthcare services is outstripping the supply of clinicians. Now, it's important to note that this graph is the way it is because most people think that healthcare delivery requires 2 people to be in time with one another, either in person or these days, because of the recent surge in telehealth, via a video call. And while telehealth and the video visit has been a boon for sure, it isn't really an efficiency gain for us. And in order to change this graph, the only thing we can do is to start to adopt one-to-many care models. And those one-to-many care models, which, by the way, you've seen this in other services that you're capturing and participating in using your mobile device, where there's fewer and fewer human beings and more software taking care of you. We can get there in healthcare too. And it's these kind of digital phenotyping tools that will enable us to do that. So really, it's all about rethinking how we manage chronic illness. That's why I want to drive home that this is not simply an academic, interesting topic. It's a really important topic. And I know all of you are committed to getting it right, but I want to make sure that you feel inspired to go forth and really get this whole thing right so that we can use it as a tool to improve healthcare delivery and get to that one-to-many healthcare delivery model. So the digital health landscape I've laid out here, and as I alluded to a minute ago, I won't be covering telehealth in this talk. Telehealth is all over the place. You're probably sick of hearing about it, but even if you're not, it really doesn't involve much in this notion of digital phenotyping, and so I'm going to skip over it. I will say that the big gain we had with virtual video visits over the last 20 months now is it's gotten patients so they understand that virtual care is possible. it's giving us a springboard on which we can achieve some of these other innovations that I'm going to tell you about and talk to you about in the next few minutes here. So don't get me wrong, telehealth, virtual video visits, very important, just not really related to the content of your conference. And I might argue not breakthrough in terms of this idea of one-to-many care, which we desperately need to get to in healthcare delivery. So let's go through some of these others. I'm going to touch on remote monitoring, digital therapeutics, and AI during the remainder of my time with you today. Remote monitoring is probably the simplest of these, but yet it still has a ways to go in terms of adoption into general healthcare delivery. It does provide us with a one-to-many opportunity, and I'll share what I mean by that just in a moment. But the notion here is that devices could be a blood pressure cuff, could be a weight scale, could be pulse ox. There are a variety of them. These days, they're all smart. That is to say, they're all connected. They all feed their data into usually your mobile device, and from there to the cloud, which once again allow them to become part of this digital phenotyping concept. Now, we have experimented with this in my lab for a couple of decades, and we came up with this model, which is sort of the granddaddy of this concept. And I share it here to just anchor us in terms of, again, this isn't all about research and theory. It's about real world need. And this is Connected Cardiac Care, which is a heart failure telemonitoring program that we created in my lab some years ago. And you can see with these devices pictured here and a nurse call center, we could achieve a decrease in readmissions, both all cause the top line and heart failure related the bottom line. And there are many, many other examples of remote monitoring that are entering the marketplace. Now there are also reimbursement codes for this activity. Digital therapeutics is up and coming. It's coming into the market, having a little bit of challenge figuring out the business model for digital therapeutics. But I want to share two examples from our own work when I ran the Center for Connected Health some years ago. The first one is called Feet Forward, which again relies on this concept of a digital phenotype. So we were able to capture from patients with diabetes step counts, motivation level, and a variety of other things that we tracked during this intervention. And we fed that back to them as a feedback loop and with daily motivational messaging based on their way that their data came across to the algorithm. And indeed, our goal was to get them to be more active. And what we see here is that BMI in that group, you can see the red line is the data from the intervention group compared to a control, which is the purple line. In significantly less over time, the BMI went down. Their A1C went down, their step counts improved, and this is all coaching with no human intervention. As I alluded to earlier, that's not particularly innovative anymore in the sense that there are companies doing that now, but at the time, this was a real breakthrough. And the other one I want to share with you quickly is called EPAL. This is a tool for cancer patients, often in hospice, to help with pain control. And it turns out to be such a terrible problem for them. And we designed it to be almost like carrying a nurse around in your pocket, if you will. And it's very highly customized. Once again, it relies on a lot of input about the patient that's individual, this notion of a digital phenotype, and gives them tools to help with their pain control and their medication adherence during their pain control. And sure enough, if you look at these data, you'll see that the top line would be the control, the green line is the intervention. And using this app over time, patients experience better pain control with no other human intervention. So two examples of how digital phenotyping can lead to real healthcare outcomes that are really important. And again, both of those are one-to-many examples. So telehealth, now a household word. We said that. We've successfully brought the doctor's office into our home. That's fine. But really what I want to leave you with or transition to AI is that the idea is it's our opportunity to reimagine healthcare delivery. I said that earlier. I just want to emphasize it again now that Telehealth is the floor. It's not by any stretch the ceiling. And so I want to finish up by saying a word or two about AI. It's a concept that scares a lot of doctors. I suspect that the scientists and attendees of this forum won't feel that way. But I like to think of it as a way of us thinking carefully as human beings about what computers do better than we do and delegating those tasks to computers. That sounds simple, but a lot of people have a lot of consternation and fear about AI. This particular slide illustrates a study that was done in the realm of pathology with an algorithm that was able to detect metastatic breast cancer cells in lymph node tissue. And you can see that the AI alone was 92% effective. The pathologists alone were 96%. When you use the computer algorithm to cull out the difficult cases and present them to the pathologist together, they were 99.5% effective. And I think this is the sort of thing we want to think about when we think about AI in healthcare. Now, I'm very pleased to point out that my colleague, friend and colleague, Dr. Michael Abramoff, has created an ophthalmologic program. This is a device that goes out into primary care and measures diabetic retinopathy using an artificial intelligence computer vision algorithm. And sure enough, Dr. Abramoff has gotten this FDA approved and gotten a reimbursement code for it. It's the first AI reimbursement code, which is why I use this example with you today. And so AI is coming. It's going to be like a lab test in primary care or the Minute Clinic. It's going to help those primary care docs thoughtfully deal with specialty problems and refer thoughtfully to specialty colleagues. It's coming in my field in dermatology as well. So that's a quick view of this notion of how digital phenotyping is going to impact the future of healthcare delivery. I hope it's been helpful to you. The solutions are all there. They're like jigsaw puzzle pieces, but if you can imagine putting 3 or 4 jigsaw puzzles on the table and mixing them up so that the puzzle pieces don't easily fit, that's the stage we're at with these tools. You can see the various things on here, and they're all important parts of this one-to-many care delivery, but we don't have them knit together in a nice tight package just yet. That's coming in the next few years. These are my contact information. I'm delighted to be able to follow up with anyone by email or on social media afterwards. And I very much appreciate, as I said, being invited today. Thanks very much.